Hello everybody,
Hey,
welcome
everybody.
back to Medical Monday. Today's a very near and dear topic because it's
Yes.
actually one of the things that we specialize here in the office. But like always, these medical conditions we go over may actually not be something that you have, but a friend or family member suffers from. So
Very true.
remember that the way that they will see this video is if we like, share, or comment so that they will be able to get the help that they need. And of course, if it does apply to you, we hope to help you out today too.
That's very true. Very, very true.
Knee pain is a topic today, and knee pain is very specific because about 30 million Americans suffer from osteoarthritis, and it's one of the conditions that cause knee pain, but it costs a lot. It's about $39 billion to care for these patients, along with the lost revenue, because a lot of times the care of these patients, especially with post-surgical, is time away from work.
Yes.
So it's a very costly condition to have, and that's why we want to help you explain what causes it, and then of course some of the things we can do.
Yeah, and just knowing the out-of-pocket costs in regards to missing work and having other doctor's appointments, I mean, that's worth the share to help a friend out, to get that information out, to let them be best supported.
One of the things I think about most with knee pain is not just the lost work, but the lost time with friends and family. You know, a lot of patients are very active in their sports groups, whether it's adult softball leagues or whether it's just the kids themselves. You know, I played sports in high school, and I find it very, enriching for children's lives to be a particular or part of a team-based sport, and then to not be able to because of an injury is very, it's very disheartening to see, and we want those patients to get back to being active as possible. Or what about playing with your kids?
Yeah, absolutely.
You got young ones you got to keep up with.
Gotta keep up with them. It doesn't matter if you just cut your finger off or not, or hurt your knee.
Our mom's fine.
You gotta keep going. It's just not an option. So you're very true. Very true.
But the knee itself, when we look at what it is, it's a very simple hinge joint, but it has multiple connective tissues that help hold it together and move it properly.
Yes, there's different layers of just about any structure we talk about when it comes to the body. Behind Lonnie's head, you can see the knee joint itself. That is just the bony structures, so they don't even have cartilage in that picture.
Kneecap.
Yep, that's the patella, the kneecap. But then over here, you see different soft tissue structures. You can see the red, where there's muscle. You can see this gray. Those are ligaments and tendons, and those cover up the joint itself. Now, muscles move joints.
Yep.
And the tendons and ligaments help to hold those in place. And so it's all about making sure those support structures are doing their job properly and properly aligned.
Yep.
The same thing here. You can just see it from a different perspective with the knee bent here, but then also a straight knee, similar to the other pictures. So it's a very simple joint in the sense of this, just how it's designed. And
simple hinge.
It's very simple hinge. It just moves in a very simple direction. But when we heard it,
then you have a lot of issues with internal cartilage of that joint space. You look at all those ligaments and tendons, the tendons hold the muscles to the bone, and the ligaments hold the bones together. Well, patients that have dislocated their knee or they've strained it in a certain way that now one of these ligaments is not holding properly, you can get wear and tear on the internal portion of the knee. And that's where we get long-term problems of patients not being able to walk. We see that progression where you start out on a cane and you move to a walker, or just that progression because of internal problems.
Yeah, and loss of that movement or function, absolutely. And you talked about the wear and tear. That's exactly what happens from these old injuries, is osteoarthritis occurs over time. So you have a normal knee joint like you see over here with the spacing and the cartilage exists, but then as changes happen, you modify your activities, you have more injuries, you live life, you do things, it progresses down the line, and then you get that Swiss cheesing effect of the cartilaginous surface.
And we look at that when I talk with patients a lot. I show them what a healthy knee looks like by a model. And this thick blue cartilage is there to protect the bone. But unfortunately, as it deteriorates, you can see that has gone away. Well, it goes away because of on the sides here. This is where those ligaments are that hold the bone. The bone should move in a simple hinge fashion. However, if you can move it, or you feel it's just uncomfortable, or you don't feel steady and stairs, that means that some of that connective tissue is not holding very well. And it's very evident when I see patients how I can manipulate or move that joint space inappropriately. And just unfortunately, we know that the internal workings of it now are affected.
Yes, and that's very concerning when that's the case. very concerned because your knee is not designed to move in those directions. So when they do, I mean, you're kind of extra special now.
There, yeah.
Yeah.
Extra special with the Swiss cheese because it just wears away at that cartilage.
Yes, very true. What causes it? Just living life.
Talk about your kids.
Yeah, like the most resilient things on earth are kids because they can kind of roll down the stairs and then get up and they're fine. But if we do that, nope, there's no coming back.
I'm not 3 anymore. Those days of getting back up are not happening.
Very true.
But that's just living life. You know, we play sports in high school. We do adult activities. We bowl. We are in the softball league. We do running. We are just active in general.
Yeah.
I know here there's a large pickleball community out at April Sound. But beyond pickleball, we have tennis. We have beautiful golf courses all throughout the area here. Yeah. And that swinging motion can twist the knee. And unfortunately, that just kind of leads to those ligaments being not as tight as they should be and can cause more internal damage.
Yep, correct. Absolutely. So it's just living life, doing your thing. That's what you do. But what can we do at home just to help us recover? I just got done with my pickleball tournament. I won 2nd place. What?
Well, first things first, you had that initial pain and swelling as the body's reaction to try and heal that damage. Ice is a good option to help decrease that swelling so it's not as painful.
Correct. Icing helps. And then also have a modification plan. If you play tennis and you're noticing that you're taking longer and longer to recover from your tournaments, one of the things you can do is actually play pickleball or racquetball. You know, there's different options to continue to play sports and do things. We just might need to back off on the routine or how intense it is and different aspects there. So
sometimes we look at golf. You know, we talk about golf as 18 holes is traditional, a day game, but oftentimes patients will then move into just a 9-hole, whether there's the front half or the back half. So you modify your plan so that you're not injuring yourself. And that's the big thing is you just don't want to re-injure the damage is already there until you can get that damage fixed.
Correct. And it's fixable. That's what's awesome about it. Yes. But then also, knee exercises have not changed significantly over the last decades. There's some pretty basic muscle groups that hinge that knee and allow it to work. So there's some phenomenal resources online to help strengthen those knee joints and make sure you get the best function and strength to stabilize and get the proper movements and proper engagement of those muscles.
They haven't changed much, and I think this slide that you got here, Dr. Gabby, is probably from the 80s.
Yeah. No, I actually think closer to like when you were born.
When I was born?
Yeah,
I was born in the 80s. No. Close. I was almost born in the 80s. But that just goes to show this slide, it's been around for a long time. We know the pathophysiology and the way that those muscles should work from in there because of the damages. And it's very simple rehab. You know, your knee only moves one way. It's either forward or back. It's not a complex joint like the shoulder or hip. So those rehab, a lot of times patients can do those at home with some very simple instructions.
Yeah, there is that one exercise I told you about that one time.
Oh, here it goes. You ready? This is the joke of the day.
Have you heard about the up dog?
No. What's up, dog?
Ain't nothing much. So what are some other things
Jared,
we can do for the knee?
Come get her. So the other things you can do for your knee, like Dr. Gabby was talking about, is you've done some things at home and you're still having some instability or some pain. We can seek out some professional help. First things first is let's stabilize that joint with some type of compression brace or a limited range brace with some other hardware to prevent further injury.
Correct. And I love that you said to go seek a professional help. There's a lot of different sleeve braces that exist out there that are phenomenal to help with the compression for certain activities. What's great when you get a professional grade braces, it's typically fitted for you, but also you said the word limited movement. Sometimes you need those limitations. It's a tool in your toolbox to make sure you get the best results and best recovery. And so these braces are phenomenal when used properly to really make sure you get that knee joint functioning and doing what it needs to do.
We still wanted to move, just not as much, or only wanted to move in a correct plane, which would be forward and back, not side to side.
Yeah, you are correct. Awesome. And then physical therapy. Physical therapy, sometimes assisted or passive movements are very important because what that allows us to do, or you to do with your knee, is to move a little farther than you can get with yourself. And then all of a sudden you realize you've got closer to full range of motion or more movement than you had before. Because we talk about that movement, the muscles, support, all those different aspects when you can actually challenge it and break up some of that scar tissue, you get more and more progression and more use out of that leg.
Yeah, that's what we want. The more use.
Yep. And then also, sometimes the pain is just so bad, you need some type of a joint injection or a steroid type injection to help reduce inflammation and allow you to use the joint through the process of that recovery.
It's a very common medical procedure. We see about 1 in 5 Americans last year received a steroid injection of some sort, whether it's the knee, the hip, the shoulder, different things. So 1 in 5 Americans had one that actually had insurance showed. So that's a pretty large amount of steroid shots being given. The VA did a large research on steroids to kind of see, pros and cons. And one of the big ones is your immune system. So be careful, especially when we have cold or flu season or when there's a new virus going around, about taking something that has the ability to lower your immune system. We really want to boost your immune system as much as possible so that you don't get sick. Unfortunately, some patients do end up having to have a steroid. So just be mindful of some of the side effects of a steroid.
Yeah. And that's worth sharing as well. Like, it's so important for a lot of people don't realize that injections like that can affect their immune system. So I do want to share, if you know somebody that has been getting them semi-regularly when needed, let them know that's something that could occur and you don't want that to happen. So, but even with all that shared, we specialize in joint pain. And so what we want to do is make sure you know what we can do here to help support you. And one of the phenomenal things about the knee joint is there's knee decompression that we can do to help really support those ligaments and tendons as we go through that process of recovery and rehab. And what this does is it just helps to very gently separate the knee joint, helps to put some tension on those ligaments and tendons so that they start to engage properly and also start to tighten and stabilize. It's just a phenomenal process. And when you talk about the comprehensive approach that we take, it is phenomenal with all the other things that we do.
Very true, very true. There's no one singular magic thing that's done. It's always done as a comprehensive plan when you're talking about any type of joint injury. You've got all the soft tissue that hold it together, that needs to function, it needs to have strength and stability. The knee decompression really helps with that to help. So you can either fix the inside or the outside, but really you've got to do both. The outside is all of the ligaments and soft tissue, and that's what the knee decompression helps with. And then when we talk about some of the internal aspects of what else we do to help with is the mobilization of it. So with that, it's manipulation.
Yeah. So you talked about the alignment. The knee joint only moves in one plane. It's flexion and extension. That's the movement. It bends and it straightens. That's what it does. And so if it gets off track, it's super important to break up any scar tissue that exists in the musculature, but then also align those joint spacing and make sure that it is tracking properly. Just like a train on a train tracks, if it veers off course, so does the train. Well, our knee joint.
Like your car. If your car alignment is off, one side of that tire is going to wear faster than the other one. And unfortunately, that's what happens with the internal part or the cartilages of our knee. If there's wear and tear on more of one side, it happens very quickly because it's out of alignment and there's inappropriate force kind of pinpointed on either the inside or the outside of the knee. Unfortunately, that's what wears away that cartilage very quickly.
Yes. And then also regenerative injections. There's a spectrum of regenerative injections that exist to help support, lubricate, and get better movement and function in that knee joint. That's actually what Lonnie specializes in and does regularly. And
I love being able to help patients. It's a natural way to help regrow that cartilage or help your body heal that cartilage damage, help your body communicate with the damaged tissue all around it, to turn on that healing process and to provide all the nutrients available that unfortunately are just not there because of structurally kind of how the joint is made up. But platelet-rich plasma all the way up through regenerative injections, a great process to help patients. It doesn't affect the immune system. There's very little downtime, and when we say downtime, it's usually just just not doing heavy activity for about a week. Other than that, patients are very active, and that's our goal. We want to keep them active. Patient comes to me and says they want to play golf, then I'm like, okay, how soon do you want to do 18 holes?
Let's get you out there.
Let's get you going. Let's get you moving. And that's the whole thing with regenerative, to combine with all the soft tissue injuries that are there to help the inside and the outside of the knee so that it doesn't reoccur and we don't just go down that path of eventually having surgery.
Yeah, we want to avoid that.
Definitely.
Yes.
But we also want you to be informed about your knee pain and for you to like and share it so that your cousin, your aunt, your neighbor, whoever else has knee pain will also benefit from knowing what's going on and what's out there to help them feel better.
Yes, that's very true. So until next week, you guys enjoy learning about the knee, and we'll see you then.
See you next week.